Good afternoon. My name is Colette Dolan. I'm the Cancer System Innovation Manager at St. Vincent's Hospital. And the title is a little bit long, but it is around enhancing the patient experience in a multidisciplinary meeting room with adjoining procedure room and sterilisation room for our head and neck patients. I'm co-author of this with Helen Brake, who's our speech pathologist at St. Vincent's Hospital, who's currently on leave at the moment, and Stephanie Scarf, who's one of our clinical nurse specialists. I'd also like to thank the Cancer Institute for inviting me here today, and also to acknowledge the head and neck multidisciplinary team at St. Vincent's, and our Director of Cancer Services, Richard Gallagher, and Gabrielle Prest, our Manager of Cancer. So I'll just give you a little bit of a background to the presentation. St. Vincent Hospital had a well-established head and neck multidisciplinary clinic, which ran for really over 30 years. The clinics were held weekly in a tutorial room in the main hospital, which wasn't purpose-built. Patients were coming to the meeting room and were assessed in front of about 13 medical practitioners. You've got your nursing, your allied health professionals, and students looking on. We didn't have a purpose-built waiting area either, so patients would be sitting out on the corridor waiting for their clinic appointment. Assessment using nasoendoscopes were also conducted in the room. So while the patient was sitting there, while all the medical health practitioners were looking on. So it was quite challenging, obviously, for our patients. And it wasn't unusual to see social work or our dietitians out in the corridor speaking to the patients, talking about how the clinic would run, and discussing some difficult around their diagnosis. Being mindful, this population were a lot from the country, so we had a lot of country patients coming up, and this was quite frightening and intimidating for them in this area. So we were looking at the privacy of our patients, which was a really big issue around that consultation. So, and in addition to that, the case summaries were developed and managed in the once the patient left the tutorial room. So how do we improve this patient experience? Well, the Kinghorn Cancer Centre, which is a joint venture with the Garvan Institute, was being developed, and this was a newly built, purpose-built cancer facility. At the time, our Director of Cancer Services, Professor Alan Spiegelman, our Programme Manager, and our Allied Health, Director of Allied Health, got together and said, well, how can we improve the patient experience? We do know that the clinic runs well, but how can we make that experience better for our patients? So we focused on the patient experience and delivering a more patient-centred model of care. But we were guided quite a lot by, and especially around the design of the room, which you'll see later, around infection control, patient safety, and also that privacy and comfort for our patients. So how we did it, I used the clinical redesign methodology, and I broke it down into different stages of the project. We set up a working party, and on that party was our clinical nurse consultants, cancer care coordinators for head and neck patients. We had the NUM of the sterilizing unit involved, we had infection control involved, and we had speech pathology also involved. We had extensive consultation with our medical oncologists and our radiation oncologists, our head and neck surgeons, and we discussing around the best technology we need to use for that room, but also around the patient journey. And we had stakeholder contact as well in terms of engagement with the project manager of building of a new facility, but we also had the architects and builders involved in the design of the unit. We mapped the patient journey, so our head and neck patients, from the time they came into centre. We were also concerned around the nasoendoscope, so we actually mapped the handling of the nasoendoscope, ensuring that we were following within infection control guidelines. So what did we come up with? Well, we came up with a purpose-built procedure room with adjoining sterilisation service. We have a state-of-the-art medical assessment with diagnostic tools in the procedure room. We designed the MDT meeting room with live streaming from the procedure room into the MDT meeting room while the meeting was occurring. And we developed policies and procedures around how the procedure room worked and also around the sterilising of the scopes. So I'll just kind of walk you through a little bit of the journey of the patient coming in. So this is the procedure room as it stands now at the moment. So we've got our chair, a stack for our scopes. The original design of this room wasn't following infection control guidelines, so we had to go back towards near the end of the project to go back in with our infection control C&C to make sure we were meeting with guidelines. So the chair was a dental chair, and this was guided by our head and neck surgeons and also by our speech pathologists, so that the patient's neck can be seen during examination. And you can see the TV screen there at the back is where the image of the patient can come up on that screen. So here we have how it works. A patient walks in. From the time the patient walks into the room, the examination occurs. So the doctors are looking at the position, how the patient is holding their head, their position, and looking at any lesions on their faces. And this room, and from here then the patient will have an endoscopic scoping done. The difference between here and before is that in the room you just have your head and neck surgeon. Now you have your nurse who runs the clinic, and if the patient would like to have a carer, the carer is there with them. So you don't have everybody looking on while the procedure is being carried out. And then that image is streamed into the MDT meeting room. There's 3 screens there in the room. So one of the rooms shows the procedure that's happening in the MDT or in the procedure room itself. We've also got a screen there for pathology or for radiology. And the middle screen there looks a bit small, but then we're getting a bigger screen for mosaic. So we've just introduced mosaic into the centre, so data can be entered in real time. So everyone can look on, discussions can be had, and the patients are not involved there. So once the procedure is finished, so then we go on to the sterilising component. Once the procedure is finished, the scope then is, there's I think this here. Yeah, there's a window here. And so the scope is passed through that window into the sterilising room. There we have a technician who comes over from the main hospital, there for a couple of hours in the morning, and cleans the scopes, and then it's put into a sterilising unit. So the unit is sterilises the scopes on site. So basically, it can hold up to two scopes at a time. And it takes about 20 minutes to sterilise a scope, which means then we can rotate the scopes through. So we can see up to 15 patients scoped in that clinic at a time. And then once the scope is sterilised, it's put into a drying cabinet, and the scopes then are sterile there for 72 hours. So what happens then there, you see there's little shelves there, so basically the nurse comes in, pulls out the shelf, and the scope is in it and can continue on with their procedure. So patient outcomes, really since January 2013, a total of 634 patients have been seen at the MDT head and neck clinic. Certainly the design of the room and has improved in communication between all the multidisciplinary team, resulting in improved patient management for our head and neck patients. It's a new model, a more patient-centric, incorporating the mission and values of St. Vincent's Hospital, and maintaining the dignity of those patients coming from rural communities. Infection control processes have been followed, and that's really been through the design of the room and the policies that we put in place. And there's also been a cost benefit. The scopes previously were moved between departments and was also moved to the sterilisation unit, and were being damaged along the way. So since we've moved in, we've only had one damaged scope. So compared to a couple of years ago, we're getting phone calls, there's a scope damaged, what do we do? So it's been really positive. So we feel we've met the mission and values of the organisation. We are especially committed to those poor and vulnerable in society. And I've just put a few comments there from some of our patients that attend the MDT meeting. So they're very impressed with all aspects of support provided. My impression of the centre is 5-star, from amenities to nursing is an amazing centre, and they're very much appreciative. And I think that's the key. People are appreciative of it. And there, just a picture of the centre. Okay, thank you.